Medicare beneficiaries, listen up. The U.S. Department of Health and Human Services announced today that the drug companies have overcharged on 27 prescriptions last year. Now, these drugs are subject to Medicare inflation rebates because the companies raise their prices faster than inflation. So they have to pay back Medicare for the difference, which could mean your out-of-pocket costs for those prescriptions decrease by as much as $390 total.
Look, it's going to change the way drugs are priced, lower the cost for seniors long term. Well, all Americans deserve peace of mind that if illness strikes or they have an accident occurs in their family, they can get the care they need, but they can afford the care they need. But the truth is, too many folks lie in bed at night staring at the ceiling wondering what they would do if something happened.
Also, out-of-pocket prescription drug costs will be capped at $2,000 for Medicare beneficiaries next year because of the Inflation Reduction Act. All right, so are you eligible? Do you know when you need to sign up? The process can be really confusing, so that's why we're going to help you navigate it. We're joined by two experts today, Catherine Sevier with AARP of North Carolina, Steve Edmonds with Alliance Insurance Services. These are your experts. We want you to get your question to them. All you have to do is text us your question. The number is 336-379-5775. Your question is anonymous, but you do get your question answered in real time. All right, so we did have some really big news today with all the overcharging and the difference in inflation and all that other kind of thing. Is there something that you want people to keep in mind, Catherine?
Well, keep in mind that these bills were just passed last year, and they're now in a situation where they are beginning to look at these charges for the first time. So hopefully you're going to see that in your pocketbook with no more overcharging on things. And I don't know what they're going to do about any kinds of refunds or rebates at this point.
Yeah, we'll just have to wait and see. But that's actually good news that at least somebody caught something like that.
No question.
All right. Steve, is there something that you wanted to talk about when it comes to like how the Inflation Reduction Act is going to like affect things in the coming year and what people need to be keeping an eye on?
I think it's some really good news for folks. And, as time goes forward, the next 1, 2, 3 years as this starts phasing in, as Catherine just mentioned, it's going to help folks. They're going to feel that in their pocketbook. And especially with the prescription drug cost, with this donut hole or coverage gap, as people refer to it, with that coming down to $2,000 eventually, that has got to be a great help to the people that end up having to take a lot of prescription drug coverage in their later years. So, it's good news financially for sure.
All right, let's talk about what happens timeline-wise when you need to sign up for Medicare, because that is always something that has great debate. Okay, so Catherine, we're going to start with you. When do you need to sign up for Medicare?
So as you approach your 65th birthday, you need to sign up for Medicare. 3 months before you can sign up, or up to 3 months after. So there's a 7-month window in there, and you must meet that window, because if you don't, there are consequences downstream with penalties. The other good news is now if you sign up, as soon as you do sign up, there is not a wait period any longer, and that is new for this year. So 3 months before, 3 months after the month of your birthday, sign up, and sign up for Part A. And make sure you understand where you sit with Part B, which is the part of our Medicare that covers outpatient and x-rays and ambulatory treatments. So please sign up for that, because if you don't, you could be subject to a long-term penalty.
Yeah, we're going to definitely talk about that, but I want to make this very clear, Steve. So there might be people who say, well, I'm 65, but I have my own health care insurance, so I don't really need to sign up for Medicare.
Correct. And you see more and more people working past age 65 today than you did maybe 10, 15, 20 years ago. And yeah, so if you're still working and you still have your group health insurance, you can actually defer to Part B until a later date in which you do retire and then kick it in later. The reason that you would do that is because Part A is free. The government does not charge a premium for Part A, but Part B, you're charged a premium for. A lot of people pay around $164 a month for Part B. So if you defer that, then you also defer making that premium payment until you really need it. So you can do that, but you need to check with your HR department, make sure that the group plan qualifies as credible coverage, and just cover all your bases. Check with an insurance professional, check with your HR department, and make sure that it's in the right place where it needs to be.
All right, right now we have Part A, Part B, Part D, and Medigap that were on the graphic there so that people knew. So we want to make it really clear. If you're still working, you still have insurance, you still have to sign up for Medicare, because if you don't, you're going to get a penalty. And if you sign up for Medicare, you need to defer Part B, which is actually checking a box. Like, there's literally a box to check that you defer it. And if you don't check the box to defer it, what happens, Catherine?
Well, if you don't check the box and you don't have credible coverage, when you try to get it later, you will get a penalty, and that penalty is 10%, and it's for the rest of your life. And if you go more than 1 year, it's additive on that. So it's a very steep penalty.
Yeah, I wish I would have known this when my dad was signing up for Medicare, because he did not check that defer box, and so now he is paying that 10% penalty every single year. Steve, did you want to add something really quick?
No, it's just so important, and I don't think people probably do not realize that the penalties can be that steep. So, it takes a few minutes to check on this and make sure that you have it right. And it's worth doing that. It really is.
It's worth asking a few more questions than someone says, yeah, everything's fine. Make sure everything's fine. All right, we're going to tell you how to do that when we come back. We can take your text questions after the break.